Intergovernmental and External Affairs. And I work specifically in our Region 6 office, which is based in Dallas. And we work with all of the 5 states in the region and the 68 federally recognized tribes that are here. And so New Mexico actually is one of those states. So very excited to have this opportunity. I was connected with Jay previously through other work that he does with Moja, and very happy that you've been including us in additional opportunities, Jay. So I just want to throw that out there and say thank you very much. I am a licensed master social worker in the state of Texas. And I, as I mentioned, work for HRSA IEA. Very excited to be here and share these opportunities with you. I have some slides in my presentation as well that'll give a little bit more info on that and other people on our team. So I'll pass it over to Monica to introduce yourself.
Hello, everybody. My name is Lieutenant Monica Geiger. Thank you so much for that introduction, Jay. I am the Regional Women's Health Analyst out of our Office of the Assistant Secretary for Health in Region 6, so based out of Dallas, Texas. Super excited to be with you today and to present with Stephen. And thank you, Jay and Kenneth, for allowing us to present to you guys today. We really appreciate it. And please feel free to reach out in the chat for any questions as we go through.
All right, so thanks for that. So we wanted to start out by giving you just a quick agenda about what we'll go through. Monica, if you want to progress, there we go. So the agenda, we'll talk a little bit about the United States Department of Health and Human Services generally, because both Monica and I, our offices sit within the department, but there's many different offices and agencies that work under HHS. So to give you a bit of context, because we are 2 people of a very large regional team, which is even part of a even larger federal national team. And then with that, I'll give you a little bit of a rundown on different HRSA programs and opportunities and some tools that you'll have the opportunity to use through HRSA. And Monica will be able to give you the rundown on OASH and what her office does and some of the priorities and concepts that are super important to public health and into the priorities of the Assistant Secretary of Health and the DHHS as well. And then we are hopefully going to have a bit of time for some discussion and Q&A, because we definitely want to hear from you as people on the ground doing the work in New Mexico. I work in Dallas, right? So I really rely on what y'all know about your places and your spaces to be able to make sure that the right and appropriate HRSA funding and opportunities are there. And so that way we can just make sure this is participatory, as Jay, you'd mentioned. We definitely are hoping for that to happen. So next slide, please. So the U.S. Department of Health and Human Services, I'll call it HHS moving forward, but the mission of the department, HHS, is to enhance the health and well-being of all Americans by providing for effective health and human services and by fostering sound, sustained advances in the sciences underlying medicine, public health, and social services. So hopefully right up the alley of the work that y'all are doing on the ground in New Mexico. And so we're going to try and make sure that our different agencies are meeting those needs. Next slide. So this is to give you a bit of context. As I mentioned, HHS is a very large department, and under that there are we have the Office of the Secretary, Office of Intergovernmental External Affairs, the Executive Secretary, and the operating divisions. So under operating divisions is where HRSA actually falls. So HRSA would be considered things as well in operating divisions, CDC, Centers for Medicare and Medicaid Services, so things like that. So that's the context of where my agency, HRSA, sits under HHS. And then next slide. And then you have the office that Monica works with, which is actually under the Office of the Secretary. And there are also other different offices that sit under that Office of the Secretary. And really what we wanted to do by showing you these different offices and the structure of it is to show that we are 2 pieces of a very large puzzle in terms of federal resources and funding opportunities that are there. And we're the experts here in the region, and we would like to be those people that can connect you even with other agencies that have local and regional presence. and to show you that by no means what we will be telling you will be exhaustive, but we definitely hope to give you enough to pique your curiosity, connect you with resources, and then to continue that and make it sustainable for now and in the future. So, Monica, if you didn't want to add anything, yet we can start with the HRSA overview. So what I'm going to start with now is, next slide, please. So the HRSA agency overview, and then I'll go a little bit into my specific office, what we do. So some of these slides, a lot of the information is going to be on fiscal year 2021 enacted funding as well as programs, but some of them have been updated to reflect the most recent instances of what is happening with HRSA. So next slide, please. This is just a quick overview of HRSA, Health Resources and Services Administration. So we support more than 90 different programs that provide healthcare to people who are geographically isolated, economically or medically challenged. So we do this through different types of grants and cooperative agreements that go to over 3,000 awardees, which include community and faith-based organizations, colleges, universities, hospitals, state, local, and tribal governments, and also private entities. And so every year, HRSA programs serve tens of millions of people, including those who are living with HIV, pregnant women, pregnant people, mothers and their families, and those otherwise unable to access quality healthcare. So it really is trying to fill the gap where traditional services or those that have issues accessing in other sorts of ways. That's what HRSA programs are trying to do is fill that gap, create that bridge. Next slide, please. So HRSA funding, and all these dollars are going to be in the millions. So this is fiscal year 21 enacted funding. And this is really just to show you that there are a lot of investments and a lot of money that's going across the country into different territories and protectorates of the United States. And so the largest number of funding will go to our primary healthcare programs. And so that includes what is our Bureau of Primary Healthcare. So whenever you think of federally qualified health centers or lookalikes, that is where a lot of that money is going to be going. Our HIV and AIDS funds are going to the Ryan White program and other sorts of funding with ending the HIV epidemic. We have a lot of funding that goes towards states for maternal and child health with block grants. A lot of rural health investment. This is just to kind of give you a sense of the sheer dollar amount that is going towards HRSA programs. So next slide, please. So as I mentioned, the largest funded program in HRSA is our health center program, and these are just some fast facts, so hopefully be quick with it. There are nearly 1,400 health centers that are operating approximately 13,000 service delivery sites, which are serving approximately 28.6 million patients in the United States. So these health centers are providing patient-centered, comprehensive, integrated care by offering a range of services, and those services are going to include things like primary medical, oral and mental health services, substance use disorder, and medication-assisted treatment services, as well as enabling services such as outreach, case management, health education, interpretation services, and transportation. Next slide, please. So a lot of the fundamentals here are serving those in high need areas. So our health center program, and those that are funded as health centers or that are lookalikes, will serve a high need community or a population. So this is going to mean a health provider shortage area, which is what HPSA or HIPSA is called, or a medically underserved population or medically underserved area, which is MUA or the MUP is. It's going to be patient directed. So private, nonprofit, or public agencies that are governed by a patient majority community board, which is important because you have the community's voice in that. They're going to provide comprehensive services in primary care and enabling services I had mentioned before, education, outreach, transport. And no one's turned away. So services are available to all, and with fees that are adjusted based on ability to pay. So there are, this is to increase access to those who traditionally might not be able to afford it or who cannot access it due to financial circumstances. And so health centers are meant to create that gap, to fill that gap. It's going to be collaborative. So they're going to work with other community providers to maximize those resources and efficiencies in service delivery. And they're going to be held accountable. So they're going to have to meet performance and accountability requirements regarding admin, clinical, and financial operations to make sure things that are up to standard. And the Health Center program is authorized as public health under the Public Health Service Act in Section 330. So you'll hear 330 grants or you'll hear H80 funding, depending on who you're speaking with. Next slide, please. And our patients are going to be 1 in 3 people living in poverty, 1 in 5 people who are uninsured, 1 in 5 rural residents, and nearly 3 million adults 65 and older. So HRSA is serving nearly 29 million patients across the country. Just some fast facts for you. Next slide, please. One of the other programs that we have is under our HIV and AIDS Bureau. And so a lot of people know the Ryan White HIV and AIDS program. So these are some information about the HIV and AIDS program that is funded through HRSA. So these funds, this program, funds grants to cities, counties, states, local community-based organizations to provide HIV care and treatment services to low-income people who are living with HIV. And then 88% of Ryan White HIV and AIDS program clients are virally suppressed, which was up from 70% in 2010. And that exceeds the most recent national average of 65%. So patient outcomes in programs that are receiving Ryan White funding are better than average, which is great to hear. And then more than 500,000 people with diagnosed HIV in the United States receive services through the Ryan White HIV and AIDS program. So that's 70% virally suppressed, up from 70%, 88%. That's a large number of people in the United States who are living with HIV who are achieving those positive health outcomes. Next slide, please. We have our Title V maternal and child health block grants. So in 2019, our Title V MCH block grant program funded 59 states and jurisdictions to provide healthcare and public services for an estimated 60.3 million people, including pregnant women, infants, children with special care needs and their families in the United States. So that's 92% of all pregnant women, 98% of all infants, and 60% of all children, including those with special healthcare needs. Between 2000 and 2018, the national infant mortality rate declined by 17% and child mortality rates declined by 26%, in part because of programs funded through these block grants. Next slide, please. So a little bit more about our Maternal and Child Health Bureau and some of the programming that's going there. We have our maternal, infant, and early childhood home visiting. So grants have been given to states, territories, and tribal entities to support voluntary, evidence-based home visiting services for at-risk pregnant women and parents with young children up to kindergarten entry. In fiscal year 2019, 154,000 parents and children nationwide received maternal, infant, and early childhood home visiting services. And then the research is showing that home visits improve the lives of children and families by preventing child abuse and neglect, improving maternal and child health, and also promoting child development and school readiness. Next slide, please. Our Bureau of Health Workforce has a lot of funding related to the health workforce. And so this primary function of this Bureau is to connect skilled healthcare providers to communities in need through grants, loan repayments, and scholarships. So the strengths of the health work strengthens, the Bureau of Health Workforce strengthens the health workforce, that's a mouthful, sorry, through more than 40 programs and initiatives that support thousands of organizations and individuals. So for example, we have the Teaching Health Center Graduate Medical Education Program, which has added 1,434 primary care physicians and dentists to the health workforce. The Behavioral Health Workforce Education and Training Program is currently on track to eliminate over 40% of the projected shortage of behavioral health providers by 2025. And the HRSA Health Workforce Connector website currently has over 28,000 sites in healthcare facilities and underserved communities that are advertising 6,000 plus job vacancies. Next slide, please. Another part of our health workforce is our National Health Service Corps and our Nurse Corps scholarship programs and low payment programs. So these programs support scholarships and loan repayments for more than 17,700 clinicians in exchange for service in high needs areas, so HIPSAs areas or MUP, MUA areas. The National Health Service Corps currently supports primary care, medical, dental, and behavioral health providers, including substance use disorders disciplines and health professions students. Our Nurse Corps currently supports licensed registered nurses, nursing students, and nurse faculty. And so NHSC and Nurse Corps clinicians provide care to more than 18 million people nationwide in rural and other high need areas. Next slide, please. Our Federal Office of Rural Health Policy works in providing policy support to the Office of the Secretary and administers a number of rural health grant programs that focus on the development of rural health networks, black lung clinics, telehealth, and the opioid crisis. So some recent statistics from programs supported by FORHP FORP is that HRSA invested nearly $1 billion from the American Rescue Plan for rural COVID-19 response, which included $398 million for small rural hospital improvements, $98 million for vaccine confidence programs, and $460 million for the rural health clinic COVID-19 testing and mitigation program. And since 2018, FORP has invested more than $400 million in over 1,500 counties across 47 states and 2 territories for substance use disorder prevention, treatment, and recovery services through the Rural Communities Opioid Response Program Initiative, commonly referred to as RCOR. And within the rural healthcare outreach programs, the latest data demonstrates that 71% of grantees reported health status improvements in at least one clinical measure. Next slide, please. And this is just another little infographic about what I had just mentioned. So HRSA has invested nearly $1 billion from the American Rescue Plan for rural COVID-19 response, rural health clinic COVID-19 testing and mitigation program, which was a $460 million, small rural hospital improvement program, SHIP, $398 million, and then the rural health clinic vaccine confidence program, $98 million. Next slide, please. And another thing that I really wanted to highlight too, considering providers and entities in New Mexico, is the Office for the Advancement of Telehealth, which is administered through HRSA. So this serves as a focal point for telehealth across all of HHS to enhance coordination with federal partners. The program and the office leverages telehealth programs and policies across HHS to improve access, enhance outcomes, and support clinicians and patients. And it promotes the use of telehealth technologies for healthcare delivery, education, and health information services. And it also provides funding for direct services, research, and technical assistance in the field of telehealth. So in fiscal year 2020, HRSA's telehealth networks saved nearly 3.8 million miles in travel for care. Also in 2020, HRSA's telehealth resource centers had a 285% increase in technical assistance requests, driven primarily by the pandemic. And in fiscal year 2019, HRSA's telehealth work group identified 1,886 grant awards with the telehealth component. So telehealth is extremely important now, and this office is helping to coordinate all those different entities and opportunities across the HHS operating and staffing divisions. Next slide, please. So that was HRSA as a whole, all the different, that even wasn't even comprehensive, all the different bureaus and offices. There are plenty more that can be talked about, but those were some of the ones that I thought would maybe be most important or pertinent to you in New Mexico. And so now I'd like to make an introduction to our regional office here in IEA, HRSA IEA, and provide some resources on finding funding opportunities and leveraging training and technical assistance that's HRSA funded and supported online, as well as making sure that you know who us in the regional office are as points of contact for that. So my name is Stephen Richards. I'm a licensed master social worker in the state of Texas, and I work as a public health analyst for HRSA IEA, is our acronym. Next slide, please. So what we do in our office, we are not necessarily a programmatic office, so we don't provide funding, but we do, our mission is to provide on-the-ground outreach to increase the reach, impact, and awareness of HRSA programs. So although we don't provide funding, we're definitely there to bring new people into the mix and to make sure that those who are already in the mix with funding are receiving the appropriate, regionally specific, contextually relevant technical assistance and training opportunities, and to make sure that in the region there's a face that you see and you don't have to think, oh my gosh, everyone's only in Rockville, Maryland, which is where our headquarters are. So what we do, as I mentioned, we extend the reach of HRSA programs by leveraging the knowledge of regional landscape, proximity, and networks of local contacts in states and territories. So When should you contact us at HRSA IEA? Really, anytime that you have any questions, I'm always here as a resource for people in New Mexico, as is my colleague, Rachel Piotrowski. And especially whenever you want to know more about HRSA programs and initiatives. So I'm super thankful. Again, I will say thank you for this opportunity to talk about our HRSA HRSA programs in order to do just that if you want to know more about what we do. And then also whenever you might need contextual information about the regional and state landscape that might impact your stakeholders as those who are working with chronic disease. And whenever you're looking for technical assistance resources, which are including funding opportunities or just new partners. And then, as I mentioned previously, our Region 6 office is based in Dallas, and we serve stakeholders in New Mexico, Oklahoma, Arkansas, Louisiana, Texas, and then all the federally recognized tribes that are within the region, which is 68 of them. Next slide, please. A little bit about our team. So I'm actually not the state lead for New Mexico, though I do a lot of work in topics that are related to New Mexico. My colleague, Rachel Piotrowski, is actually our New Mexico state lead, as well as the lead for the 68 federally recognized tribes in Region 6. And she's our regional point of contact for rural health, border health, telehealth, maternal and child health, as well as opioids. I am our regional point of contact for behavioral health, HIV and AIDS, COVID-19, and our HUD-HRSA partnership, which was a partnership to connect HIVAIDS communities with COVID-19 vaccinations. And to say that, this delineation of responsibilities is true. And I will say that we are very cooperative in our office. We work very collaboratively. And anytime there's a question that, I can't answer related to behavioral health, related to rural health, I'll pull Rachel into a conversation. Or if there's stakeholders who are reaching out to me in New Mexico, I will typically loop Rachel into the mix of it all too. So, whomever you come to as a point of contact in our office will find the right answer for you. And if we can't give it to you, we'll be able to find that headquarters point of contact to be able to provide that information. Next slide, please. So I think this is one of the things that will be really important for people who are interested in finding HRSA specific funding. And it is this link, which will be provided later on. And it is on the HRSA website, hrsa.gov/grant/find funding. And this is an opportunity for people to look for funding that's either currently open or that has been open in the past or is forecasted to be open. And you can actually sort it by any sort of program. So program meeting, primary care or HIV and AIDS or other sorts of opportunities to look at that. And it tells you when it's open, when the application will close, the program category, whether it's Bureau of Health Workforce or Maternal and Child Health Bureau. And then this will link you to the grants.gov website announcement that'll have all the technical documentation for that. If you're looking for HRSA specific programs, this is an opportunity for you there. Yes, thank you. I just noticed Monica dropped it into the chat. So that was there for people to be able to find HRSA programming and funding for. Next slide, please. And specific to chronic disease, I wanted to highlight our HRSA Training and Technical Assistance Hub, which the link for this is at the top of this slide, and this is a screenshot of the page that you will see. So you'll go to this top banner, click Training and TA Hub, and you click Chronic and Infectious Disease. And there's also other opportunities for behavioral health training and technical assistance, child and adolescent health technical assistance that you can navigate through here. And so this list that you see that's under the title Chronic and Infectious Disease will have all the different opportunities that are HRSA funded and supported there. By no means is it exhaustive, but it's definitely a pretty comprehensive place to start any sort of search related to any of the health topics that HRSA funds or supports that you might be interested in. If you'd like, next slide, please. We actually have an upcoming webinar series, which is one of the things that we do in our regional office to make sure that we're promoting technical assistance and trainings that are regionally specific, or at least would benefit the region. So it's our Advancing Health Equity Among the Hispanic Population webinar series. And it's a webinar series that's actually presented in Spanish. And this session that happened today was simultaneously translated into English. So that way those who do not speak Spanish were still able to participate. And it's about best practices and opportunities for action in the realm of health equity with those who speak Spanish. So the session today has already passed, but the next session will be December 15th, and it's about Latino Hispanic communities in mental health. So the role of community health workers and the antidote for compassion fatigue. That will be forthcoming. And so the link to the registration for the session that happened today is in there now. And as those other links come out for the next sessions, we'll be sure to forward them to those of you at the Chronic Disease Prevention Council to share with your membership and those who were on this call as an opportunity. This is for a save the date for those of you who are listening now. So hopefully you'll have an opportunity to join the next 3 sessions. And I will say the November 17th session and those going forward have been recorded, and the recording will be available for those who would like it. So don't fear you didn't miss out on today's. There's still an opportunity for you. Next slide, please. This is just the Region 6 contact information. So both mine, Rachel's, as well as we have a general inquiries inbox. Feel free to reach out to any 3 of those emails. And we also have a regional listserv that we send periodic information out. So if you're interested in that, definitely something to reach out to us to be added to. Next slide, please. And with that, this is HRSA's general website. Feel free to go to that. We also have a HRSA-wide e-news blast that goes out pretty frequently, and we're on all the social medias as HRSA as an agency. So please take the opportunity to do that if you are a Instagrammer or a Twitterer or anything like that. So, and with that, I believe the next slide is the beginning of Lieutenant Geiger's presentation. So I will go through the chats because I notice there's a few HRSA questions.